Greetings from Swaziland. We are a small country of over just 1 million, the last remaining monarchy in Africa, situated between South Africa and Mozambique. Swaziland has the highest HIV prevalence and TB prevalence globally, with 26% of all adults HIV positive. Nevertheless, the situation is improving. Our government has enrolled an extensive ARV treatment which now reaches 85% of those who qualify. The TB situation is not as promising. The prevalence of TB is 854 per 100,000 population. The incidence is 1,317 per 100,000 population. 80% of TB patients are co-infected with HIV. 14.3% of all TB cases are retreatment cases. More than a third of them are multi-drug resistant. The situation is worsened by abject poverty. 2/3 of all Swazis survive on less than $1 per day. The only way to turn the tide is by detecting TB cases early, initiating them on TB treatment and monitoring them until they have completed treatment. This requires large community networks, which our government does not have. But the Catholic Church has a network of parishes that covers the whole country and reaches even the most isolated rural areas. Most parishes have networks of home-based caregivers. We propose that these networks be redeployed to be the front line in the fight against TB. Caregivers will go from door to door, visiting every house in their communities. They will administer a questionnaire with 5 questions to each occupant. If the answer to one question is yes, the caregiver takes a sputum sample to be tested at the local clinic. If it tests positive, the patient is initiated on TB treatment. The caregiver monitors them daily for adherence until treatment. This program is being run with success by the Catholic Church's caregivers in South Africa. Since it started, there's been a 4-fold increase in the number of patients being initiated on and completing TB treatment. We want to replicate this success. This program is cost effective. It requires no capital expenditure and no training. It can be implemented in communities with very low literacy levels. But it will have a big impact on reducing the incidence and prevalence of TB in our country. It will maximize the uptake of TB treatment in the public health sector. It can be scaled up in every place where it is implemented and can be replicated in every community of our country. So we appeal to you, partner with us. Together we can turn the tide of TB in our country.